When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
This may be a wake-up call for guys who think you can treat women like that and then buy their silence.
No, having the objective to play a game to lose, not in favor of that.
Let's meet our victims for today's edition.
This is the Big Five on the Elias Macco Show, brought to you by investment advisor Richard Lapointe of CIBC Wood Gundy. Richard Lapointe can always be reached at 847-6324.
Welcome to the Big Five. It's Quebec Budget Day. We'll get into that on the Big Five a little later on. But first off, we got more serious, pressing issues. Joining me on the Big Five this morning, Trudie Mason. Good morning.
Good morning.
Political analyst and Lagace-Dowson. Good morning.
Bonjour, hi.
Bonjour, hi to you as well. All right. Italy yesterday decided to go into lockdown. Okay? Sunday, it was just the northern part of the country lockdown. A day later, the whole country in lockdown. This is not, a backwater. This is a first world nation, right? This is in Europe. They've got a superb healthcare system. They got universal healthcare. I guess the question I have this morning, and I don't think this is being alarmist. I think this is trying to be calm and rational. What we know about how the virus spreads, just over 2 weeks ago, Italy had 5 cases. Just over 2 weeks ago, 5 cases. We see where they are today. Shouldn't we be proactive here in Canada and start saying maybe we got to think about, maybe not a full lockdown, but maybe we have to say school should close, large gatherings, let's not do it for the time being. Why are we waiting till the situation gets to a more difficult spot? It's a serious question here. I don't think I'm being alarmist by asking that question. I want to avoid what's happening in other countries, and I think it's a really common sense solution to say, okay, guys, suck it up for a couple of weeks. We're going to try and keep this at bay.
I tend to agree, actually. I see that the Pearl Jam concert's been postponed.
Pearl
right?
Jam was postponed. I mean, I know we're talking about our St. Patrick's Day parade in Montreal.
Maybe the one in the state in Boston, I think,
Boston,
been canned.
All over Ireland,
New York. Yeah. So I think maybe some kind of preemptive plan is in order, and I think the public should be informed of it. I would point out in Italy, the population is significantly older on average. That's one of the reasons why the numbers of fatalities has been so high. Italy is a country that, in terms of population, is stagnating and even shrinking. So their demographic is very different from Canada's. That's not to say the disease is not very serious, and it's not just elderly people who are affected, but it's mostly respiratory infections.
The reports from inside hospitals that are at 250%, 300% capacity.
Oh, no,
now.
I know. There's a really alarming, there's a lot of alarming stuff on Twitter about what's going on in the hospitals, where the doctors and the medical staff are freaking out, burning out. People are dying in the hallways. They haven't got enough people and material supplies to intubate people who need to be intubated. I mean, it's really very sobering to see this. So I'm thinking maybe we do need to make some kind of plan. And I'm not thinking just in terms of coronavirus. I'm thinking in terms of general health strategies. Like we shut down a whole bunch of local hospitals. We put everybody in super hospitals or so-called super hospitals. We have much less chance of containing stuff if and when it happens than we used to do. So I think we probably need officials to step up and reassure people with plans. Like I noticed the Prime Minister's been very quiet on this. I haven't heard a ton from the Premier either.
The real Prime Minister, Christopher Freeland's on top of it, so at least that's something.
But I mean, I think a lot of people are concerned. I think there's a lot of hysteria as well. I see people in the metro wearing those really ineffective white, fat, paper masks, which are the only point in wearing those is after you've been infected. There's no point in wearing it preventively. So there's a lot of misinformation.
Well, I think that the problem is that, what exactly do you want to do? What exactly?
We're not experts, though. They need to tell us.
I understand that, but what do you expect? Because just say, for an example, they close the schools. Okay? Because schools are a vector of contagion anyway. Kids go gastro. They're always bringing something home, right? So you close the schools. So now the kids are at home. That means the parents are at home. to a large degree
Yeah.
too. So then you have massive absences in workplaces.
Yes.
So then you have stores that can't function to sell people the things they need, like food and toilet paper, so then you have even more stockpiling and huge lineups and people standing around in lineups and chaos. So, and every time I think of what you could possibly do, that's what it ends up in. It is chaos, because make no joke, in Italy there will be chaos going forward. Even though
Well,
they
to be honest,
announced,
we're seeing
No,
it. It doesn't look like
no,
chaos.
it
It looks
does-
like
no.
ghost towns,
Well,
and everyone's at home, and it's being in an orderly fashion.
Everybody is at home day one. What about day two, when they need fresh fruit and veg, and the government has said, "Oh, by the way, the grocery stores are going to stay open"? So what exactly is going on there? That's not a lockdown if you can go to the store to get fruit and veg.
They're not letting people in, I think, is more the point.
Yeah,
right?
and I understand the travel question. I think travel is taking care of itself. Qantas just announced that it is actually taking some of its larger planes out of circulation for a while because it can't get the bookings to keep them flying, and it's also going to be reducing its schedule by something like 25% for a number of months because of the knock-on effect. So I think to some degree people are taking care of it themselves. The only thing that I can think of, expanding on, is the recommendation that came out of the CDC yesterday, I believe, where they said, if you're over 60, stock up on food and probably toilet paper and stay home. If you're over 60, because this is not a killer virus for most people. It seems to be hitting older people much harder, and it seems that the fatalities...
It is a killer virus.
Yeah, and the fatalities are in the older age category to the most degree. So if you're gonna engineer or manage upheaval in Canadian society and in the economy, that might be a place to start. You're over 60, stock up, stay home.
I think also we need to hear from public health authorities as to what they have in mind if and when the cases start coming in. And I don't think we've heard that. Because we hear about nursing shortages, we hear about backed up emergency rooms, we hear about lack of doctors. I think what we need to hear is, okay, we got this contingency plan, this is how we're going to implement it, this is who's going to do it, this is what you should do if a member of your family presents with symptoms. Just basic ABC stuff that I haven't heard yet.
I know I use the term lockdown, but there's no like military in the streets. You can still go where you want if you need to go, but the idea behind it is, let's not get large groups of people together until this thing is under control. I just think we shouldn't wait until we've got all of our hospitals at 200% capacity. Yeah. We should think about it now. Yeah. So, listen, the Canadians game that's going to be played in San Jose in 9 days.
With no audience, right?
Well, right now, they cannot hold the game with a crowd, right? So either they'll move it, right? This is in San Jose. It's in the county that they've banned all large gatherings over 1,000, right? So, to me, that's common sense. Let's think about some of those measures. We don't have to stop anyone from going to the grocery store, but maybe you have to put in measures in place like they've done in restaurants in Italy, where people have to stay away from each other. You don't crowd a restaurant now. Now it's got to be a little bit more sparse. To me, that seems like it's common sense, especially knowing that 1 in 5 people that get coronavirus or other viruses, they're these so-called super spreaders, right? That have a really tremendous ability at spreading this stuff out.
Typhoid Mary, the famous case. Was it typhoid or typhus?
Well, she was asymptomatic. But I understand the point you're trying to make. They're also saying that between, I think it's 35% to 75% of Canadians will eventually get this.
How many?
Now, 35 to 75% of Canadians will eventually get this. That's what I figure I saw. I can't quote the source though. This morning.
Sounds very high, but anyway.
Well, I saw 40%, which is right in that ballpark.
So how long do you intend to maintain a lockdown? Your version of a lockdown?
I'm not in favor of a lockdown, by the way.
Listen,
think we need a plan, and it's going to test, like in the United States, where there is no healthcare system really in place. This is going to be a disaster. In Canada, where we have a healthcare system, spotty though it may be in some ways, there needs to be plans.
But I think we have a plan to a large degree health-wise here in Quebec. They're opening up the new COVID clinics. One of them has already started seeing patients yesterday. So that means if you have symptoms, you don't go to the super hospital, you go to the COVID clinic. And so you're not spreading it into the hospital system.
I am thanking the powers that be that we're in Canada every day in this crisis, right? I mean, I think we're in good shape, but that doesn't mean
You need
that
to
in
thank
2 weeks...
Tommy Douglas and the people who push for public health care.
And the doctors and the professionals.
Yeah,
but
and
that
the
doesn't
people who
mean,
do
like
the
in
good
Italy, 2.5 weeks ago in Italy, I don't know if they were having this kind of discussion that we're having today. And I don't want to be in 2 weeks having a much more serious discussion.
I think they didn't know. I think we're learning more every minute on this thing. Nobody understands even how it's spreading. They don't even get that.
The stories the office is buzzing about. The Big Five on the Elias Macco Show.
Back here on the Big Five, and Lagace-Dowson and Trudie Mason in the studio with me. Quickly, guys, I want to talk about this story about this Montreal restaurant, an old Montreal restaurant. It's called License 4 in Old Montreal. And on their, like one of their windows, they used one of these pens that you can write on windows with, and they wrote a joke, okay, on their window. And the joke read, no coronavirus here. That was the joke that they scrawled on the restaurant's window. Woman walking by sees this, woman from Vancouver, sees this and gets really upset about it. Posts about it on Facebook, in fact. But she starts banging on the window. Owner of the restaurant comes out. There's a kerfuffle. By the way, I'm seeing people make jokes about coronavirus every 2 seconds. Like in this office here, I'm overhearing people. When you're like, "Hey, how you doing?" and the response is, "I don't have coronavirus yet." How are you doing? People are making jokes. If you're a restaurant. And on this program, by the way, yesterday, I interviewed the owner of a restaurant in Chinatown. Their business is down basically 50%. Chinatown, stone's throw away from Old Montreal. And the sign says, no coronavirus here. What do you think, guys? Bad joke?
I didn't have a lot of sympathy for the woman involved who was walking along the sidewalk until I started to consider what the situation must have looked like from her perspective. This was late on, I think it was Friday night into Saturday. The guy in the restaurant who was responsible for the sign admits everyone was drunk. They'd had a big party there for friends and clients of the bar restaurant. Everybody was drunk. They put this sign up, and then as people passed the restaurant, they started the people inside started tapping on the glass and pointing at the sign. He says we were trying to invite people inside to join us because we were having such a great time, but
they took it as a message.
I started thinking about being a woman of Asian origin walking down the street, and you're walking by this restaurant, you see this sign, and there's a bunch of drunk people tapping on the glass and pointing at you and pointing at the sign. And yeah, I think her perception was that they were being racist, and I understand that. Now she got furious, and there was that confrontation, and she went online and posted it, and it blew up in a big thing. I don't know if it deserved that much, but I do think we have to put the shoes on and understand why she thought she was being racially targeted by that. I think her perception was absolutely understandable.
What she said, I agree. And I think people's nerves are a little bit fragile right now around this whole thing. Like like newsrooms are notorious for black humor, gallows humor, right? Because often the news is super bad, so it's a way of coping. But not everybody functions that way, and I think there has been a lot of racism and stupidity around this coronavirus thing. Like, did you see this story about how people are not buying Corona beer? Mm-hmm. Because it's called Corona beer. Like, this is completely irrational and ridiculous.
Well, you know what? I don't. By the way, I think you can know that Corona doesn't cause the coronavirus, and also not to want to have it in your house because you don't want to see that word right now. I mean, I think you can have both, right?
It's really the two things have nothing to do with each other. Anyway, I think people are sort of flying off the handle. In this case, this woman, I think there's been damage done to statues in front of Buddhist shrines. There's been damage done to the marble lions in Chinatown. Like, all of a sudden everybody's saying, it has to do with Chinese people. It has nothing to do with Chinese people. It has to do with the way the economy is structured in China and these markets of wild animals. It's got nothing to do with actual individual human beings, right? So I think it's really unfair, and we have to be super vigilant about that, because the natural reaction of some people is to go into backlash mode as soon as something terrible happens, and we have to try and fight that as best we can.
The guy at the restaurant who was responsible for this went online and apologized, being drunk is no excuse, but he did explain the situation from his point of view.
His statement, direct quote, "There were no racist intentions behind this message. It was childish, yes, but not racist."
And
that's what he says.
I'm sure from his point of view, that's absolutely true. But again, you have to be the woman walking down the street. What she saw in front of, behind that sign was a restaurant full of people gesturing at her and probably in her mind, taunting her racially. So, yeah, I think we have to be a little bit more aware.
Yeah.
Even if we are drunk, we have to be a little bit more aware.
And a 5-minute walk from Chinatown, too, on top of this all. Okay, let's go to Quebec City. Budget day, folks. We're getting a budget this afternoon. They're in lockup as we speak, all the journalists in Quebec City. What are you expecting from the Quebec government this afternoon?
I think it's pretty much status quo. They're going to brag about how they've got this surplus, and they're going to say the job situation is great and the economy is great. Although I see a new wave of poverty in Montreal. I know there's been food shortages at the Food Depot and NDG, and I see a lot more panhandlers in the metro and on the streets. So, and housing prices have gone way up. So on the one hand, we maybe have a good job situation, but we have crap jobs a lot of the time, and people going to the food banks to end off their months. So I think what we're going to see is the CAQ government saying, "Yay, we're so great," and I'm going to be thinking, "Yeah, maybe you're not that great." And I would like to hear from them about a contingency plan for coronavirus. I think it should come up in the budget, and I suspect it won't.
So this is the thing that gets me is this talk over the last 24 hours, like, hey, you know what? The budget was locked down 3 weeks ago.
Yeah, right.
And I'm like, hold
Before
on a
this
second,
thing
guys.
hit, yeah.
Hold on a second. There's two ways you can look at it, right? Quebec's economy, the Quebec government's financial situation, their books are so good, the surplus is so big that, you know what, in their minds, we can go ahead with the 3-week-old budget because we'll be fine. We have money in the bank, unlike some other provinces. So you can do it. You can look at it that way. The other thing is, this starts to happen, and you know it's going to affect the books. Why don't you delay the budget? Well, this is not an excuse to say, hey, it's 3 weeks old, we had to lock things down 3 weeks ago, and we can't do anything about it, right? Yeah.
I'm not following that. What?
Okay, so
I don't know, honestly. Why delay? To me, there's absolutely no point. I also think the CAQ is completely overconfident.
Cocky would be the word?
It's very cocky.
Yeah.
They also have this $1 billion electrification plan that they're just dying to trot out, and I think they want to get ahead on that because they want the good PR from that. I think we actually might see some negative stuff in the budget, but they're going to try and green over that by talking about how all the provincital vehicles
negative.
are going to be.
What do you mean by negative? What do you think?
I think there are going to be some cuts. This was not a government that got into power by promising to grow government. It promised to run the government like a business.
What the heck are you cutting in this province? They can't,
they can't really cut too much more.
Honestly, you need to ask that.
Yes.
Yeah, with a government that has surpluses like we have, yeah, I do need to ask it. We're not in austerity mode anymore. We're doing quite well. We got a 10% PST.
How well do you think we're going to be after we spend $1 billion a year for the next 4 years on electrifying government buildings and vehicles?
Yeah. I'm just saying, I don't think cuts are coming. If they're going to do anything, they'll cut revenues by cutting taxes, give another nugget for taxpayers. Of course, I think
you have more optimism than I do.
I think they'll wait another couple of years before they go that in. But I don't think this is a time or a place for them to do any budget cuts. Like, they're going to cut healthcare? They're going to cut education? They're not doing that. They're spending more money in those sectors. So I don't see where they're going to cut.
I don't think they're spending more money in those sectors. They just spent the last 5 or 7 years cutting those sectors.
They're spending more. I mean, obviously in healthcare, it's incremental and a lot of it's tied to inflation. But in education, they're investing heavily. They are. After
years of cuts under the Liberals and even the Péquistes, right? Like if you ask anybody who's in the teaching profession, they'll tell you the libraries have closed, the special ed stuff is cut way back. There's there's no nurses in the hospital, in the schools. There's they're the services have really dropped. And the buildings themselves are in terrible condition. The water can't be drunk in my kids' school because there's too much lead in the pipes. So cutbacks, but abandoning certain parts of the public sector. I mean, that's what's happened. This money that we have in the surplus probably should have been spent on the infrastructure.
Guys,
never mind the roads.
When you go to a rock show and the front man of the band shouts out the city's name, do you like it? Do you like when you go to
Every
a
time, everyone cheers.
Woo, Montreal!
Yay. Yeah,
Okay,
whatever,
so listen, this didn't happen in Montreal, but we got a shout out, and I think a lot of people are excited that we got a shout out. This is from Fox News, their town hall with Bernie Sanders, and Bernie Sanders on healthcare. Have a listen.
Is doing what every other major country on earth does, guaranteeing healthcare to all as a right. I live 50 miles away from the Canadian border. This is not a communist society up there in Montreal. They guarantee health care to all. They spend 50% of what we spend. Is passing a Medicare for all single-payer system a radical idea?
Bernie Sanders last night, clearly someone who's never been to the People's Potato at Concordia University, but he's making a good point. Guys, what happens tonight in the primary? 6 states are voting. It looks like Joe Biden might sweep the table. If that happens, is it game over for Bernie?
I hope not. I find the way the Democratic Party has conducted itself really terrible. And I think this guy Biden is, I think, not really up to the task. I mean, he seems to have...
Not up to the task?
I don't think so, no. I mean, I think
I
he's
could say a lot of things about him. I don't know about not up to the task.
I'm a big Bernie supporter and have been for years.
So am I.
Yeah. So this guy... He's been consistent. He's honest. He's, and Biden has a really spotty record. Anyway, I think
he's been consistent. He's been honest. He's also probably going to lose 6 states tonight.
Yeah, I hope not. We'll see. I mean, there have been some surprises along the road. I'm still holding out hope.
Yes, I am too, because I think it would be a much more interesting finale if he hangs in. But they say that he has to hang in for a month before it swings around to states where he's going to perform strongly. Can he hang on until then? I don't know. Will the donations keep coming in? Will he be able to maintain the momentum if he does badly? I worry. And I also think that... what's weighing in his favor is that Joe Biden seems to stumble a lot. And he has been talking openly now about his stutter and how he suffered a lot as a child as a result of that. And I think he's hoping that is going to smooth over any concerns about his fitness for office, in terms of mental lapses or anything like that. He's going to label all of those a function of his stutter. And I don't know if that's going to work. And the more we see of him, I think the more questions there will be about that.
He was asked, Joe Biden was asked on MSNBC yesterday, and the question he was presented with was, let's say the House of Representatives, Nancy Pelosi, and let's say Bernie Sanders in the Senate, they get bills passed for Medicare for all, and it ends up in on your desk. Joe Biden didn't say, yeah, I'd pass it. He said, in fact, the opposite. Oh, no, the costs are going to be too high, and that it wouldn't be a no-brainer for him to pass this bill. And I said, wow, what a difference, right? Between 2 candidates. Thanks, guys, for coming in.
Pleasure.
And Lagace-Dowson, Trudie Mason, thank you so much.